no pregnancy anywhere in the world that is comfortable after 9 months. Everything God created in this life has time. Even human being, you have a time. So anything that does not have time is false. Now, I had this patient in 2023, a 65-year-old woman who came to the hospital with twins, 2 babies, a boy and a girl. Odioko, mele wanya anya. Those babies were sick. Mele the woman anya. Wanya murunwa, ara ya na abaju. And every even wanya murunwa na akoyako, ona di ya na aho. Maju told the woman, please, owuki murunwa, ya gwam doc no ya murunwa. No umwa umu ya, gwam aha ya na agwole ya, gwam ebe ha muru ya, gwam mbe ya tụtara ime and everything. But one striking thing ọ gwara m bụ ọ sị m na ụmụ a na ọwụ scan niile hụrụ ya mgbe ya dị ime. Na ọwụ only one scan na ahụ ha, and the scan ahụ nọ n'Owerri. So I picked it, cryptic pregnancy. So m na-ele ya anya, I na-breastfeed those babies, a na-enye ha milk. I invited the police secretly. Police abịa mee interview. She took me in, showed me her episiotomy. Episiotomy bụ court anyị na-enye ụmụ nwaanyị ma ha na-amụ nwa. Isi ha ga-aba. So enye ha court to give more way ka isi nwaanyị pụta. She showed me the episiotomy cut. The episiotomy cut was healing. Now, police came back and spoke to me. Doc, what do I think? I said, this is fraud. This is scam. A 65-year-old woman, abala menopause, cannot conceive unless or by the experience or by the intelligence of IVF. Any other thing, the time for giving birth has passed for that woman. Police took her, arrested her. Immediately the brothers, everybody came. And after 2 days, she called me. I came to the police station. She confessed to me on how everything happened. It was an arranged pregnancy. Neya bura female 2 years and 3 months. And on where scan na here now was scan no nowhere. So and he who the experience had a no mwanya. So only hormones so they're responsible for pregnancy. I know those hormones, pregnancy hormones. Those things are those hormones, pregnancy hormones. You start feeling, your tummy will start coming out. You start feeling as if you're pregnant, but you're not pregnant. Now, achopota the time, and whether a baby age somewhere. At time mother pregnancy, abagi me ga amumwa, me bata tomorrow. E bata tomorrow ahonye nka ha batala somewhere. The other room. Then ebido bawa oxytocin. Oxytocin who the hormone who the responsible for akpamwa in our contract. And akpamwa in our contract organ in Philippines. Ana abago gwa ana manega kanu gwagi ni no 2 cm. Only ajine ege digi wonye nka ahụ nọ na the other room. So as soon as onye nka ahụ dị fully dilated, ready to push. Once onye nka ahụ dị ready to push, abago and you get a high dose of oxytocin, you start feeling so much pain as if you are West Chorebawa. Abagi that you should get ready, that you are ready to give birth at that time. Then they can give you some sedatives like pentazocine, ketamine, no bagi. Egadi awake, egadi you be awake, but you're not fully conscious. Nganine gane megota. They will give you a cut. Even when the name now, that even the bringing the husband. Once any get caught, you are bleeding. Only kahamona na the other room. A cruder baby with blood, placenta and everything. And everything. The wife is bleeding, the baby is bleeding, blood everywhere. So okay, it's very difficult. That man, equal niha have arrangement. Because naturally, anyane eku muoke ni bateba na monwa. eme ya ụta ahụ clean the baby na ọ n'ihi gị clean ye baby nwaanyị a na-ebe akwa na anya na-atọ ọnụ ya si ekwula okwu ị na-amụ nwa ịmụrụ nwa ekwula okwu na ofu ebe aka eklinichaa gị eme nke a emechi ya niile were nwa ahụ kwunye that man si ya kpụrụpụ outside clean ye the woman at that time the woman dịkwa drowsy anya na-eme ya ụtọ ụta ekwupụta ya onweghị ihe ga-agbada woman na ọmụghị nwa ọ ga-ekwe onweghị ihe ga-agwa the husband na ọmụghị nwa the husband ga-agwa gị na ya bịara ebe a nọ mụọ nwa ahụ. Now, how do you know actually will give you a cryptic pregnancy? How will you know? Number one is, in 90% of centers and a cryptic pregnancy, they are not qualified. They don't have a name. That is one. Two, here Ogawati Nepueba, no hospital, only center na hide what they know how to do best. Onwe center, Google the just Google IVF centers in Port Harcourt. They will list them for you. So you know what I hide is not genuine. I can tell you, I told you the hospital I worked with in Nigeria, in Abia State. I don't need to hide it. Go there and ask of Dr. Onokaji, they will tell you. So it's not hidden. That is one. Number two, older women, very old women. Number one, they will tell you that they have experience. Now, how many have for 30, 40 years? You will tend to believe them. I know when now they've employed the intelligence of very frail, unexperienced medical doctors to back themselves up. Akwaha each deal, akwaha 1 million or whatever. Now, how will you know that is false? Onye wala ga-abịa gwa gị na ị ga-atụ ime without adequate medication. Odioko ka m gwa gị essential truth nọ na ya wụna. Ihe ihe gbasara nwaanyị ịtụ ime na nwoke ịtụnye nwaanyị ime, it is 100% medical. Chineke na-enye nwa o. I've seen where God intervened. I've seen a case in the world. But from here now, I'm talking from the place of my profession. It is 100% medical. No drug can give you pregnancy. No egg, no fruit can give you pregnancy. Pregnancy with the principles. A woman is only fertile 4 days in a month. Just 4 days. After those 4 days, once that 4 days is the ovulation period, once any center that will not respect the principles of conception is false. In that area, they don't track when you ovulating. Or meet your husband. Even on what we call ovulation induction, will prepare you towards the prepared period of your conception. And you're possible. Your egg can only produce 4 days in a month. Anyway, delay, about 5 days. They don't obey the principles of ovulation. Number two, pregnancy is verifiable everywhere. Pregnancy is not a hidden disease. That is why your tummy will come out. And I hide it. So ebo lega agbaga na Oscar na anya and ụmụnwaanyị ndị ahụ na-agbaghị ihe ndị a ụfọdụ ha gacha secondary school, ụfọdụ ha ga primary school, ha pịa nwaanyị aka n'afọ pịa aka n'afọ ha agbaghị na ọ dị 6 months na nwa gị na ọ nọ n'azụ na ịkwara nwa n'azụ megide ihe ahụ ihe a m gwara gị na will play out. I had a woman who came to one of the hospitals I was working with in Aba. Gwa m na ya dị ime na asị ya na ọ ga-amụ nwa next month na ya chọrọ ịbịa ịconfirm ma nwa ahụ ọ kaala. Ọ nwere ya na-akpọ clacking. Anyị ga-clack gị jụọ gị ajụjụ n'afọ ole ya sị na ya nọ 52 years. Kemgbe ịhụrụ period gị last na ya hụ period ya 4 years ago. M jụwa ya okay. So okay, anyị ga-eme scan. Eme scan was not telling us anything. Masị onye gwara gị na ya dị ime ya kpọrọ ma a na-akpọ ha mama something. Either Mama Ngozi or mama wati or mama anything. And I ha mama something. Ya gba mama gbara na ya di ime na ọ ga-amụ nwa next month. My brother, a male scan, the woman has a very large fibroid. And look at these things. The drugs, the hormone replacement therapy will grow whatever that is in your womb. Or when you with a fibroid, those hormones will grow them, will make them big. Will make them big. They will become big. Why? In with a fibroid. And look at the size of the fibroid you have. Very big. Yes, I'm now Brian Adime. Must okay. From our findings, and look at when he got one in there, they will believe the truth. There's nothing you will tell them they will believe. Because if you want to catch a woman, most of those women they use prayer. Na 67 years old. And Iman, faith comes by hearing. And by hearing of those things. So I get build their faith. So you only in a kugodi in a corobis. Magwata that woman. Yes, I'm not here, ma one ya di me. Dig out their way. Mba. Iwurumole na ya nwuruma ato. No kwado na that woman mo na yuma ato down. Odioko, in the last 10 days, more than 10 men enyana ma number for DNA test. In the last 10 days, more than 10 men abroad has contacted me for a reliable DNA center in Nigeria. And most of these men, about 7 of them, Nagimu had DNA, their wife are there away. It's because of these things. It's because of these things. Oh no, wala boragi, no mureba ga pogi ga ka agadi wani. Hana ukari agadi wani. Ka agadi wani, mama onye dota, ka opi aga akona afọ, nyegi nka, onye nka ige tinye naku, na ega adi ime. It is lie.